If you're a woman between your mid-30s to 50s and you feel like your body has quietly changed the rules without telling you, you're not imagining it, and you're not broken. For many women, this season of life marks the beginning of something called perimenopause. Perimenopause is not menopause. It's the transition phase leading up to menopause, and it can last anywhere from 4 to 10 years or sometimes even longer. Menopause itself is defined very simply as 12 consecutive months without a menstrual period. Perimenopause is everything before that point, when your ovaries are still functioning, but no longer doing so in a predictable, steady way. This distinction matters because many women are told they're too young for menopause when they bring up symptoms in their late 30s and early 40s. What is often missed is that perimenopause can begin much earlier than most people realize, sometimes as early as the mid-30s, especially in women with high stress, autoimmune disease, thyroid dysfunction, and a history of eating disorders, also with chronic inflammation or significant life stressors. At its core, perimenopause is a hormonal transition, but it's not simply about hormones declining. In fact, one of the most confusing and frustrating aspects of perimenopause is that hormones don't just go down, they fluctuate, and sometimes wildly. In your reproductive years, estrogen and progesterone follow a fairly predictable rhythm across the menstrual cycle. Estrogen rises in the first half of the cycle, ovulation occurs, and progesterone rises in the second half. These hormones don't just regulate fertility, they influence your brain chemistry, sleep, metabolism, immune system, gut motility, and cardiovascular system. As perimenopause begins, ovulation becomes less consistent. And when ovulation becomes inconsistent, progesterone is often the first hormone to decline. Progesterone is only produced in significant amounts after ovulation. So if ovulation is skipped or delayed, progesterone drops. This creates a state that many women experience as estrogen dominance, not because estrogen is necessarily high, but because progesterone is no longer balancing it. At the same time, estrogen itself becomes erratic. Some months it may spike higher than it ever did in your 20s. Other months it may fall abruptly. Your body is no longer following the old script. You may feel like yourself one week and like a stranger the next. You may sleep beautifully for a few nights and then suddenly develop insomnia. Your cycle might shorten, lengthen, get heavier, lighter, or disappear for the month, and then return. Many women notice that their periods change first. Cycles may be shorter, sometimes every 21 days instead of 28. Bleeding may become heavier or more clot-filled. PMS can intensify. Breast tenderness can increase. Migraines can appear or worsen, especially around ovulation or just before the period. Mood changes are also extremely common. Anxiety that seems to come out of nowhere, a shorter fuse. Feeling overwhelmed by things that never used to bother you. A sense of emotional fragility. These symptoms are not character flaws. Estrogen and progesterone directly affect neurotransmitters like serotonin, dopamine, GABA, and norepinephrine. Progesterone, in particular, has a calming, anti-anxiety effect on the brain. When progesterone declines, many women experience increased anxiety, restlessness, or difficulty shutting their minds off at night. Estrogen fluctuations can amplify emotional sensitivity and stress reactivity. Sleep disturbance is one of the most common disruptive symptoms of perimenopause. You may fall asleep easily, but wake up between 2 and 4 in the morning with a racing mind. You may wake up feeling unrefreshed. You may suddenly become sensitive to caffeine or alcohol. Night sweats or feeling overheated at night can appear years before true menopause. Weight changes are another major concern. Many women notice that what used to work no longer does. Weight may redistribute towards the abdomen. Muscle mass may decline even if activity levels stay the same. Blood sugar becomes more unstable. You may feel hungrier, crave carbs, or feel shaky if meals are delayed. This is not simply a willpower issue. Estrogen plays a role in insulin sensitivity, fat distribution, and muscle maintenance. As estrogen fluctuates, your metabolism becomes less forgiving. Cortisol, the stress hormone, becomes more influential. If you are already living in a high-stress state, the metabolic effects of perimenopause can be amplified. Brain fog is another hallmark symptom. Difficulty concentrating, forgetting words, walking into a room and forgetting why you're there, losing your train of thought mid-sentence. Estrogen has powerful effects on brain energy, metabolism, and blood flow. During perimenopause, the brain is essentially adapting to a changing fuel environment. This is one reason many women worry something is seriously wrong, when in fact, their brain is responding to hormonal shifts. Joint pain, muscle aches, and new stiffness can also appear. Estrogen has anti-inflammatory and joint protective effects. When levels fluctuate, connective tissues may feel more sensitive. Some women feel like they've suddenly aged overnight, even though they're exercising and eating well. Skin and hair changes are common too. Skin can become drier, thinner, more sensitive. Acne may reappear, particularly around the jawline. Hair shedding can increase. Nails may become brittle. These changes are often subtle at first, but can feel distressing, especially when they appear unexpectedly. Sexual health is another area that often changes quietly. Libido may decrease. Vaginal dryness may begin long before menopause. Arousal may feel different. Some women experience discomfort with intercourse, and they don't understand why, especially if their cycles are still regular. One of the most challenging aspects of perimenopause is that symptoms are often dismissed. Women are told it's stress, anxiety, depression, or just aging. They may be prescribed antidepressants without a conversation about hormones. Or they may be told that their labs are normal, which technically can be true because standard lab ranges are really broad and not designed to capture hormonal fluctuations. Perimenopause is a clinical diagnosis, not a lab diagnosis. Blood tests can be helpful, but they don't tell the whole story. Hormones fluctuate day to day and week to week during this phase, so a single lab snapshot may miss something that's happening functionally. Understanding perimenopause matters because it's a window of opportunity. How you support your body during this transition influences not only how you feel now, but your long-term health after menopause. Bone density, cardiovascular risk, cognitive health, metabolic resilience, and immune function are all affected by how this transition unfolds. Lifestyle factors become more impactful during menopause. Sleep is no longer optional. Stress management is not a luxury. Nutrition needs a shift. Protein becomes more important for muscle preservation. Blood sugar regulation becomes critical. Overexercising and undereating can backfire more easily than it did in your 20s. This is also the time when unresolved issues may surface. Thyroid dysfunction may become more obvious. Autoimmune conditions may flare. Gut issues may worsen. Trauma, burnout, and chronic stress may finally demand attention. Perimenopause does not cause these issues, but it can unmask them. Your body may no longer tolerate the level of output you once maintained. There may be grief, anger, or fear associated with these changes. None of this means you're losing yourself. It means your body is asking for a different kind of partnership. Perimenopause is not a failure of the female body. It's a transition that deserves education, support, and respect. There are many ways to support women through perimenopause. These include targeted lifestyle changes, nutritional strategies, stress regulation, sleep optimization, addressing nutrient deficiencies, supporting the gut and liver, and in some cases, thoughtfully prescribed hormone therapies. Hormone therapy is not a one-size-fits-all, and it's not mandatory. But for some women, bioidentical progesterone or estrogen support can be life-changing when it's used appropriately and monitored carefully. For others, non-hormonal strategies may be sufficient. The key is individualized care. What matters most is that women understand what is happening to their bodies and know that help exists. You're not weak. You're not dramatic. You're not imagining things. Your body is transitioning, and it deserves informed, compassionate support. If you're a woman between your mid-30s to 50s and recognize yourself in this conversation, the most important thing to know is that you're not too late to the conversation. You are right on time. Perimenopause is not something to fear, but it is something to understand. And understanding gives you back agency, clarity, and options as you move into the next chapter of your health and your life.